Hi, my name is Erin Pearson, and I'm a research scientist at the Center on Gender Equity and Health at UC San Diego School of Medicine. And I'm presenting today on women's choice to include male partners in family planning counseling, looking specifically at the roles of intimate partner violence, reproductive coercion, and covert family planning use. And I'm happy to be here today on behalf of my co-authors who are at Population Council Kenya, IPAS, and IPPF. So to start off with a little bit of background, so we know that engaging men in family planning counseling really is a strategy that's used globally to support voluntary use of family planning. But there have not been many studies that have considered women's and girls' preferences for involving their male partners or looking at how experiences of violence really influence those preferences. So that's our objective today, is to understand how women's choice to involve their male partner in family planning counseling relates to previous experiences of physical and sexual IPV, reproductive coercion, and covert family planning use. So to answer this question, we conducted secondary analysis of data that comes from two trials that tested an intervention that provides education on RC and IPV and offers male partner counseling. So the data come from two countries, Kenya and Bangladesh. In Kenya, we have 659 female family planning clients aged 15 to 49. And in Bangladesh, we have 2,686 abortion clients aged 18 to 49. So to take a look at this, we're going to be using logistic mixed effects models to test these associations between our key independent variables of interest and desire to involve the male partner in family planning counseling. And all of the models adjust for clinic level clustering. So overall, we found that that about half of clients in both Kenya and Bangladesh desired to engage their male partner in family planning counseling. It was 43% in Kenya among family planning clients and 49% in Bangladesh among abortion clients. We also found that across contexts, violence was a common experience. So the rates of RC varied. It was 45% of family planning clients in Kenya and only 10% of abortion clients in Bangladesh. But violence, physical and sexual IPV was more common. So it affected over half of women in Kenya and about half in Bangladesh. And physical IPV was the most common form, but sexual IPV was also very common in the study population. So about a third of women in Kenya and 12% in Bangladesh. We also took a look at covert family planning use in the past 3 months, and that was 13% of family planning clients in Kenya and 8% of abortion clients in Bangladesh. And so taking a look at the associations, we found that in Kenya, we found lower odds of wanting to involve a male partner for those experiencing RC and sexual IPV, and also for those using family planning covertly in the past 3 months. In Bangladesh, it was a similar picture, lower odds of wanting to involve the male partner in family planning counseling for those experiencing IPV, and also for those covertly using family planning in the past 3 months. So our overall conclusions, violence is a common experience for women and girls who are seeking family planning and abortion services. We find that, the desire to engage their male partner in family planning counseling is lower, I think unsurprisingly, among women and girls who experience partner violence. And we find, because the data were collected in the context of an intervention, we find that, with this comprehensive counseling that was conducted as part of the intervention, clients who have experienced RC, IPV, and those who've recently used family planning covertly, really are less likely to desire engagement of their male partner, and I think, able to make the decision that is best for them in their particular situation. So overall, we conclude that women and girls should be counseled and empowered to decide about male engagement themselves. Blanket approaches that encourage male involvement for all clients really may not be desirable and may not be safe for many women and girls, especially those who are using contraception covertly. And, just as an overall conclusion, we feel that, data really demonstrate that women and girls must be the ultimate decision makers on engaging their male partner.